Hello, my name is Natalie Lewis, and this is my presentation, Research Proposal, Issues that are Influential to Burnout Rates Amongst Mental Health Professionals for Liberty University, Advanced Research Quantitative Research and Analysis course. The grant that applies to this proposed study is the Behavioral Health Workforce Development Technical Assistance Program and can be found at the following website. The current proposed study seeks to shine the light on burnout amongst mental health professionals. Based on these findings, this researcher aims to identify tools that can help create programs for mental health practitioners to avoid and manage burnout disorders. Emotional weariness, depersonalization, and diminished sense of self, personal success are the hallmarks of burnout, a psychological illness. Mental health professionals frequently experience burnout due to the pressures of treating patients or clients. There are common risk factors and consequences of burnout amongst these professionals. Causes and symptoms of burnout in mental health professionals. They frequently manage high caseloads and complex client needs, resulting in prolonged stress and fatigue. The heavy workload, the workplace relationships significantly influence burnout levels. Poor communication also adds to this, as well as lack of support from colleagues and supervisors that can make it even worse, according to O'Connor 2018. The interplay between psychological distress and physical ailments underscores the urgent need for interventions to treat burnout within this workforce. Understanding these symptoms and consequences is crucial for developing effective strategies that promote resilience among these professionals. The impact for clients and coping strategies for MHPs. Emotional exhaustion, a primary symptom of burnout, undermines practitioners' capacity to engage empathetically with their clients and, of course, give effective treatment, according to O'Connor 2018. Vital coping strategy, seeking supervision or consultation with colleagues is helpful, and as well as regularly discussing cases and sharing experiences can also provide the emotional support and facilitate professional development, according to Smith 2018. Effective approaches include self-care practices such as physical activity, mindful techniques, and adequate rest. Also, engaging in these activities can help to replenish emotional reserves and reduce the stress levels of this profession. Additionally, mental health professionals need ongoing support to prevent, manage, and reduce burnout. The problem statement and purpose. The problem of burnout among these professionals have become increasingly, obvious and prominent, raising concerns about their well-being and the quality of the patient care that they give. Despite the growing recognition of this issue, there remains a lack of consistent definitions and assessment methods to handle burnout and the prevalence and impact of this workforce. The purpose of this proposed study is to systematically investigate the phenomenon of burnout among them and delineate its prevalence, cause, symptoms, and consequences within contemporary healthcare challenges. This proposed study seeks to identify key factors contributing to burnout, such as excessive workloads, poor work relationships, and exposure to, the client and their traumas, according to O'Connor 2018. Furthermore, it explores how systemic issues like understaffing, and inadequate support mechanisms make this even worse, in terms of the challenges associated with it. So the method would be the null hypothesis. Burnout is assessed by the Maslach Burnout Inventory Health Services Survey, where the focus for mental health professionals who resumed working after the pandemic will not be predicted by factors examined by the Pandemic Experiences and Perceptions Survey. Alternatively, the hypothesis is burnout is assessed by the NBI-HSS in mental health professionals who resumed their work after the pandemic will be predicted by the PEPS. The NBI-HSS explores different components for this. The PEPS assessment offers vital details about disruption and resources, risks, perceptions of leaderships, and open text items. Additionally, for this investigation, no control variables will be included for burnout as assessed by the MBI-HSS. Will be the proposed studies dependent variable. The factors causing burnout as determined by the PEPs will be the proposed studies independent variables. Now we talk about Liberty University's mission and purpose. So in accordance with the university, this proposed study is being presented for this grant and will bring to fruition with the following guidance in mind. Maintaining the vision of the founder, Dr. Jerry Falwell, developing Christ-centered men and women with the values, knowledge, and skills essential to the impact to the world. The university educates men and women who will make important contributions to their workplaces and communities, follow their chosen vocations as callings to glorify God and fulfill the Great Commission according to this webpage. The proposed study hopes to contribute to this area of research for my colleagues, other fellow mental health professionals, and for those who are entering into the field to gain knowledge of how to navigate these issues before, during, and after they arrive. As we put God first and assist each other in our callings to glorify Him, we can also be in service to others who are practicing mental health professionals who in turn assist others. And finally, to conclude, thank you for your time and attention to this proposed research study. Mental health professionals are in need of opportunities to prevent, treat, and of course work through burnout. In this helping field, it's so important and it's imperative for them to have resources that are easily accessible. We help them, they help others, and in turn we all serve God. And thank you for your consideration. I hope to receive this grant to do this work and to do this, as it is a well-needed work. Thank you so much. And the other slides are the references. Thank you. Bye.